Botox, also known as botulinum toxin, is a widely used treatment for both cosmetic and medical purposes. It works by temporarily paralyzing muscles, which helps reduce the appearance of wrinkles, treat chronic conditions like migraines or excessive sweating, and more. However, like any medical treatment, Botox comes with potential side effects. These side effects can range from mild and temporary to more serious ones. Here's a detailed look at the possible side effects of Botox. Common side effects: injection site reactions. Pain, swelling, or redness at the injection site is common and usually resolves within a few hours to a day. Bruising can also occur, especially in areas like the forehead or around the eyes, and may last a few days. Headache or migraine. A headache is one of the most common side effects, especially for individuals undergoing Botox for chronic migraines. The headache can be mild to moderate and typically lasts for a day or two after the injection. Muscle weakness. Since Botox works by temporarily blocking nerve signals to muscles, muscle weakness is a potential side effect. This is usually mild and localized to the treated area. For example, if Botox is injected around the eyes, it may temporarily cause mild weakness in the eyelids, resulting in difficulty blinking. Less common side effects. Ptosis, or drooping eyelids, is one of the most common concerns for Botox treatments around the eyes. This can happen when Botox spreads slightly beyond the intended area. Ptosis is typically temporary, lasting a few weeks to a couple of months. Asymmetry or uneven results sometimes occurs after Botox injections. This might look like one eyebrow being raised more than the other, or one side of the face appearing different than the other. This is usually correctable with additional injections or adjustments by your provider. Neck pain or stiffness, especially when Botox is used for treating conditions like cervical dystonia, which is a neurological disorder that causes muscle spasms in the neck, can occur. This side effect is more common in patients receiving Botox for medical purposes rather than cosmetic treatments. Dry mouth or difficulty swallowing can happen when Botox is injected into areas near the mouth or throat for conditions like excessive drooling. This is particularly concerning if the Botox spreads to areas it wasn't intended to affect. Some people report feeling fatigue, mild fever, or general body aches after Botox injections. These symptoms typically resolve after a few days. Allergic reactions. Although rare, allergic reactions to Botox can occur. Symptoms of an allergy might include rash, itching, swelling, especially around the eyes or lips, and difficulty breathing or swallowing. If any of these symptoms occur, immediate medical attention should be sought. Botox spreading beyond the injection site. Botulism-like symptoms. Botulism is the illness caused by botulinum toxin, can occur if Botox spreads to areas beyond the injection site. These symptoms include difficulty swallowing, breathing difficulties, muscle weakness or paralysis in areas not treated, and vision changes, such as blurred vision or drooping eyelids. While extremely rare, this can be a serious issue, particularly in patients receiving high doses of Botox for medical conditions like spasticity. Respiratory issues, in rare cases. If Botox affects muscles involved in breathing or swallowing, it can result in serious respiratory issues, especially in individuals with pre-existing conditions like neuromuscular disorders. Severe headache or neck pain, especially with high doses. In some cases, patients using Botox for medical treatments such as chronic migraine prevention or muscle spasticity may experience intense headaches or neck pain after high-dose treatments. These symptoms usually go away with time. Precautions to take. Pregnancy and breastfeeding. Botox is not recommended for pregnant or breastfeeding women, as the safety in these conditions hasn't been fully established. Neurological disorders. Botox should be used with caution in patients who have neuromuscular disorders, like myasthenia gravis or ALS, as it may exacerbate symptoms. Allergy to Botox. If you've had an allergic reaction to botulinum toxin in the past, Botox should be avoided. Some people may develop tolerance over time, meaning that Botox becomes less effective with repeated treatments. Long-term use in some areas may lead to muscle atrophy, which is muscle weakening or shrinking, particularly if Botox is used to treat muscle spasticity or dystonia. Most side effects of Botox are mild and temporary, often resolving within a few days to weeks. The risks are generally low when performed by a skilled professional. However, it's important to discuss any concerns with your doctor before undergoing treatment and to ensure that Botox is appropriate for your needs. If you experience any unusual or severe side effects, seek medical attention immediately, as some side effects can indicate more serious complications. Would you like to know more about a specific side effect or how Botox works for a particular condition? Feel free to ask.